Hi, I'm Brian Catterley. I'm one of the faculty at the Williamsport Family Medicine Residency Program. And I'm going to talk to you a little bit about preventative care screening tests, what tests we order, what we're looking for, and what we'd actually do about them if any of them turn up positive. Dr. Enoch Say put together this really wonderful infographic that you can download in the comment section below. It's for adults and goes over all of the generally recommended screening tests. So I hope you enjoy it and use it. Screening tests are really kind of the foundation of preventative care and family medicine because we lean on those to help us prevent disease or diagnose disease early in its process. So all the screening tests that we're going to talk about are the ones recommended by the United States Preventative Service Task Force, which is an organization put together to analyze whether these screening guidelines are actually worth it, both for the payer but also the patient. So these recommendations change every year, it seems like. So absolutely talk to your family doctor about what the updates are. But these are more or less the minimum guidelines on what you'd be expected to do if you're a generally healthy adult. Now, men and women are going to have slightly different variations on the same schedule, different cancer screenings, for example. So pay attention to that in the document below. So we'll start off with cancer screening for women, but all adults, frankly, will have screening for high blood pressure at least every 3 years in adulthood. Now, you probably would have that kind of a screening every time you go in a doctor's office and they take your blood pressure. But at least every 3 years in the first years of adulthood, and then eventually yearly after age 40. Diabetic screening starts at age 35, and you can do that either with a fasting blood sugar or an A1C, and that's conducted about every 3 years. So both men and women should have sexually transmitted disease screening every year, or at least be offered that every year. And they should also be offered hepatitis C screening at least one time in their lifetime. Now, unlike men, women will have cervical cancer screening or pap smears starting at age 21 and then every 3 to 5 years after that. So breast cancer screening will begin at either age 40 or 50 based on risk or family history, and that's going to be done every 1 to 2 years, usually with a mammogram. And just like men, women will start screening for colon cancer at 45, and the frequency will depend on what type of screening they choose. Now, two of the more common types of screening are Cologuard, which is a stool sample test that you can take at home, and then colonoscopies, which thankfully are every 10 years as long as they return a healthy result. Now, smokers need lung cancer screening every year with a CAT scan, and that starts at the age of 50 for both men and women. And finally, women will need DEXA screening or bone mineral density screening, and that starts at the age of 65, and it's usually done every 2 years. For men, colon cancer screening and lung cancer screening are the same as for women, as well as blood pressure, diabetic screening, and STD testing too. But also for men, they should have their cholesterol checked every 5 years starting at the age of 35, and that's commonly known as a lipid panel. Also specific to men is screening with an ultrasound for an abdominal aortic aneurysm, which is something commonly found in smokers and those who have a family history. So those two demographics should have abdominal aortic aneurysm screening with an ultrasound just once starting at the age of 65. Now, somewhat controversial is prostate cancer screening, and the USPSTF recommends screening only those high-risk populations. Now, you may have risk based on a family history or because of a certain ethnicity, but definitely talk to your doctor about screening for this one. So that rounds out the recommended screening for adults. Nowadays, it's really not necessary to do yearly labs unless they're otherwise indicated, but you also don't need to fast most times for lab work. So a question that we get all the time is, what do you actually do if one of these tests comes back abnormal? And frankly, with lab work, most labs, or most people I should say, have 1 or 2 abnormal labs or slightly abnormal, and I would just recommend following up with your doctor about what those actually mean, because screening tests, the definition of screening tests is that they're not diagnostic. They don't really tell you exactly what's happening. They just tell you what might be happening in case you need to look further. So absolutely, for all of these tests, the main takeaway point is go see your doctor, and your doctor can kind of lead you through the next steps and what to do about any of the results. Thanks for watching. Again, these are the minimal guidelines and recommendations put out by the USPSTF for screening. Now, your situation may call for more screening, and there are plenty of different other guidelines out there from different organizations for specific diseases. But this is a great starting point and kind of foundation for screening for preventative care. So click on the download link below and you'll find our infographic. You can share it with employees, with friends, with yourself. It's a great one-page document on all the basic preventative screening due for adults. At the end of the day, my major recommendation regarding screening and preventative care is to talk to your family doctor about it, specifically about any of the results, and at least touch base with your family doctor at least just once a year, not necessarily for a physical, but at least a discussion about what you can do about your health care and what you can do in terms of preventative care to screen for and help prevent a lot of these common diseases. So I wish you the best of luck and hope to see you soon.